Good morning and welcome to Leon County Today with Sheriff Walt McNeil. I'm Shonda Knight, and as Sheriff, our topic today really focuses on the care, custody, and control of inmates at the Leon County Detention Facility. And those 3 C's you talk about a lot.
Well, that first one, Shonda, is the most important one, care. When people come to us, that's the first thing we teach our inmates and we teach our staff is when you come to us, we're going to do the best we can to take care of you. You have to help us in that process. The people we have are inmates, but they have to help us in terms of trying to make sure we care for them. Care, custody, and control. While they're with us, we're going to make sure that we do everything we can to get them back into our community better than when they came to us. But that's a daunting task. That is extremely difficult to do. Many of these people come to us with mental health issues. Some come from a homeless environment, and when they get there, we have to do a huge assessment. And that assessment deals with both the care, custody, and control, but it also deals with our trying to figure out exactly mentally and physically where is this person. And we have a great organization, a company that works with us called YesCare, and they assist us in that care part, mostly the care piece of trying to take care of these persons who come to our detention facility. We have, I think, one of the best detention facilities in the country, and we are very significantly impacted by the care and control that we get from the YesCare organization that comes alongside us. Yeah,
they provide health care, and I think that's a component a lot of people may not necessarily think about when they think about a detention facility, is that there is a health care component. A lot of those individuals who come to us have health care needs, and specifically mental health.
Yeah, Shonda, you know, and I hope some of our audience out there knows that in our community, the largest mental health provider in our community is the Leon County Detention Facility. And I'm not bragging about that, something we're trying to correct, obviously, but at the same time, we need our citizens know how daunting a task that is, and we can't do that by ourselves, and that's why we bring in experts like YesCare to stand alongside us and deal with the care of those persons while we have them in our custody. The idea is that we return those persons back to our communities a lot better off than when they came to us on the front end. And I'm excited about the fact that we're going to hear more from YesCare about how we in fact do that. How working side by side with them, we're able to, in most instances, take those persons back to our community better than when they came to us.
Yeah, that is certainly the goal. Well, you want to be sure to stick around. Coming up, we will talk with a representative from YesCare about those health care needs at the detention facility here in Leon County. Stay tuned.
Good morning. I'm Captain Jimmy Goodman with the Leon County Sheriff's Office, and this is your Safety Tip Tuesday.
School is back in session. Follow these school bus safety tips to ensure you and your children's safety. Watch for and obey signals from school crossing guards. All drivers moving in either direction on a two-way street must stop for a school bus displaying a stop signal and must remain stopped until the road is clear of children and the school bus stop arm is withdrawn. Arrive at the bus stop with about 5 minutes before the bus is scheduled to arrive.
Have a great week. Stay safe out there.
Start your new career as a corrections officer at one of the state's most innovative agencies, the Leon County Sheriff's Office.
When I left the academy, my training never stopped.
Work with state-of-the-art technology.
You can make a lot of money at a very young age.
Starting pay is $50,000 a year with amazing benefits.
Firearms, taser, driving training.
A better work-life balance with more time off.
They're going to sponsor you through the academy and pay you while you're there.
Join the family. Apply today at leoncountyso.com.
Welcome back. Today we're learning more about the medical provider for the Leon County Detention Facility and the role they play. Joining us now is Anthony Waters, Senior Vice President for YesCare. Tell us about your career and exactly what do you do for YesCare?
Well, first, thank you for welcoming me on. It's a pleasure and an honor to be here. It's hard to believe this, but as a clinical psychologist, I've been working at the intersection of behavioral health, the criminal legal system, and government for over 16 years now. First as a psychologist for the NYPD, and then in various positions within the New York City jail system, overseeing and developing solutions to mental health programming there. And for the last 6 years, I have been with YesCare as the Senior Vice President of Behavioral Health. I first came into this, working with this population, because it was interesting.
Okay.
But I stayed because there is an enormous public health need.
There is.
I'm driven by the belief that we are all much more simply human than otherwise, whether we be free, incarcerated, experiencing privilege, or facing disadvantage. We are all much more simply human than otherwise. And we live in a world where we focus so much on division, but at our core, we have hopes, dreams, aspirations, and it's our aim to take this time that somebody is incarcerated and try to work towards realizing some of those opportunities.
Wow. Well, talk to us about what are the services that YesCare provides to us in the Leon County Detention Facility?
We are a full-service healthcare provider.
Okay.
On the mental health side, we provide everything from short-term, brief, solutions-focused intervention, where we might see somebody for just a few visits to help stabilize them as they're going through the adjustment of incarceration, to long-term individual group psychotherapy. We also provide psychotropic medications when clinically indicated. And as a company, YesCare is built on the foundation of over 40 years of expertise and clinical innovation in this area. We are in jails and prisons throughout the country. I'm very proud to say that we are in 8 facilities here in Florida, and we value our partnership with the state and with you tremendously.
Talk about the qualifications and the background of the staff we have there at YesCare, particularly as it relates to the mental health issues and how YesCare assists us in making sure those persons perhaps don't harm themselves while they're in our care.
Sure. We have a team of 9 mental health professionals at Leon County Detention Center. It's led by Dr. Carla Sapp. I was meeting with her this morning and she said something to me that was so poignant. What drives her in this work is the will to foster the why. And I love that, to foster the why. For her team members, it's about helping them to identify their professional mission. Correctional mental health work is a specialty, and we need to view it as such. And helping professionals attach themselves to that why and build it is everything as a leader. And for the incarcerated population, the why is about their recovery journey, fostering their will, their why to take this challenging time and turn it into an opportunity for growth, for wellness, and ultimately for recovery. As I mentioned, we've got 9 professionals on our team, and that includes licensed clinicians, behavioral health technicians, psychiatric providers. We are a full-service team that aims to meet the patient where they're at. Regardless of the acuity of their symptoms, we want to deliver the care that's necessary to help foster their why.
Now, one of the things we are very proud of is the fact we work with YesCare and you're our provider. But what about our staffs? How do our staffs coordinate? I've got my staff and then YesCare staff. How does that coordination work in terms of keeping those persons safe and taking care of them while they're in our care?
Yeah, we have to work hand in hand. We are better together. And so the collaboration is constant throughout the day. You know, in doing this work, it's almost like a Venn diagram. We have our own training as healthcare professionals, just as correction staff have their own training as security professionals. Yet, when we spend time together building our collaboration, we realize that those circles overlap tremendously. And being able to foster that overlap and work collaboratively towards our shared goal of a safer, healthier facility and how that translates to safer, healthier communities is paramount. And so day in, day out, our teams are collaborating very closely, continuously throughout the day.
Hold that thought, I want to come back. Up next, Dr. Waters talks to us about addressing mental health challenges in the Leon County Detention Facility. Stay tuned. We're back with Dr. Anthony Waters, Senior Vice President of Behavioral Health for YesCare. Dr. Waters, talk to us about the number of persons in our communities compared to the number of persons in our detention facility or any facility in terms of suicides, and what does those numbers look like?
Let me start by saying that in jails nationally, suicide is the leading cause of death. Let me say that again, the leading cause of death. In the community, it doesn't crack the top 10. So right away, that shows us an enormous disparity between the wellness of our communities versus the wellness of our correctional institutions. And there are a lot of reasons that contribute to that. One being that when people come into jails and detention centers, they're coming in their most desperate time. Another being, as you mentioned, detention centers are the de facto mental health provider in many communities. They're the largest provider in communities. And so we are treating a medically complex, socially complex, often marginalized population that is heavily, heavily traumatized. And when they come into the facility, they bring all of that with them. Now, we do a lot of work to try to foster safety and wellness and recovery. It begins with acknowledging that the risk is tremendous, and it continues by working collaboratively with custody staff, as well as seeing suicide not as a mental health problem, but as a social problem. That means that we are all collectively responsible for trying to reduce the risk. And so we work collaboratively with our nursing team, our medical team, our custody partners, and of course, at the core is behavioral health, facilitating that engagement to try to reduce the risk.
What are some of the things that we can do strategically to try to address the issues of mental health and suicides in our communities?
Yeah. Well, the first thing is to continuously encourage the dialogue. For so often, suicide has been treated as taboo. When we don't talk about it, we don't enable our communities to understand the why. There we go again, fostering the why. We have to be willing to investigate, and we have to be willing to critically look inward. Part of what we try to do within our teams is foster that culture of collaboration where we are willing to look inward, to ask why, to see what we could be doing more of, to what we could be doing better. And that enables us to constantly innovate our practices. We are always adopting evidence-based practices as suicide prevention. And when there aren't any to fill a direct need within the correctional institution, we look for an established practice that we can adapt to that environment so that we are constantly evolving to meet the unique needs of the incarcerated population, which is a microcosm of our communities, and to ensure that we're delivering the best care possible.
Well, thank you for that information. So what advice would you give us at our detention facility in terms of how we both educate our community about these issues, and how do we compare, quite honestly, to other detention facilities or prisons around the country?
Yeah. Well, let me say this. We are increasingly here in Leon County moving further and further ahead of the status quo, both in terms of the programming we offer and in terms of the outcomes we deliver. And the first thing that we can do is encourage people that when we see somebody that we worry about, and by the way, we get that feeling here. We don't get it first here, but we might feel that something isn't quite right with that individual, and to ask directly about it. Are you having thoughts of death? It's hard to feel comfortable with those kinds of challenging questions, but by doing so, we can save a life. And that's what we train our staff to do. That's what we encourage our custody partners to do, and we offer lots of wonderful trainings on that as well. And you and your team have been wonderful in encouraging those sorts of conversations. And we've been really successful. Nationally in jails, the suicide rate is nearly 50 per 100,000. We are far ahead of that in YesCare, and we are doing wonderful work here in Leon County.
Yeah. Dr. Waters, what, in about 30 seconds we've got left here, what advice or what kind of message can you deliver to our citizens out there about the care that we provide here in Leon County?
Yeah. Well, I'd say that we are a part of the community. Jails and prisons are viewed as external entities, separate, not to be looked at, but we are a part of the community. And so we have to be working together as a community to work on the social problems that lead to incarceration and the issues within incarceration to return the people as they go home, as you mentioned, in a healthier place than when they came in.
Well, thank you, Dr. Waters. Up next in our Deputy on Duty, a Leon County School Resource Deputy shares the most important lessons he's learned on the job. Stay tuned.
Summer has come to an end and school is back in session. And this deputy on duty meets Sean Strickland, the school resource deputy who is dedicated to positively impacting students' lives through each interaction.
So I'm Deputy Sean Strickland with the Sheriff's Office. I've been with the Sheriff's Office for roughly 11 and a half years. I did about 5 years on the road, 3 of those as a training officer. And then I will be starting my 7th school year in the school resource unit.
Choosing a career in law enforcement was easy for Deputy Strickland because he always had a strong passion for serving and giving back to his community.
I'll put my age out there. I'm 40 years old. Moved to Tallahassee. I was 9 months old, so it's pretty much all I knew. So I kind of thought the idea of serving the community I grew up in would be really neat, and so far so good.
In his role as an SRD, he has the chance to open the line of communications between youth and law enforcement, fostering an atmosphere of education and trust.
So anytime I have an interaction with a student, I try to make it as positive as possible. I think it's a big deal that they know that we are just regular people. We have a job to do. We're not always there to come up with a negative solution to things. So it was big for me to get there, kind of boots on the ground, be in the schools where the majority of the youth in the community is, and having those one-on-one interactions and explain things and how we do our jobs and why we do it the way we do.
Working in the schools affords deputies the opportunity to directly influence students' lives and guide them towards a positive direction.
Your mouth is more of a tool than anything you got in your belt. So it's very big, and I know the agency is big on de-escalation. So when you get and encounter those situations where a student may be having a crisis or going through some stuff, my first course of action is always to try to de-escalate, calm them down, see if we can resolve it with nobody getting hurt, them not going to jail or anything of that nature. So if we can just kind of calm the situation down, and usually it works. You know, they're just going through a moment. They need to work through some things. They've probably got some things going on in their lives that you're not privy to.
An SRD's role involves numerous tasks, but the primary objective is to ensure everyone's safety on campus.
So we're contracted to be there 30 minutes before school, 30 minutes after. Typically when I get there, obviously set up. Some of my staff hangs out in the courtyard. I'll get with them. The biggest thing is you really don't have a routine per se. You don't really want to have the same routine where people can pick up on where you'll be and all that. Kind of keep it changing. But the biggest thing is two things: visibility, especially times of like transition when the kids are between classes, when they get there in the morning at arrival, and dismissal when they're heading to the buses and to their vehicles. So visibility and availability.
Even after school hours, our student resource deputies remain dedicated to actively finding new ways to engage with Leon County students.
I think there's an assumption that when summer rolls around that we got a few months to ourselves. That's not the case either. There's programs that the Sheriff's Office has implemented that we do as a whole through the school resource unit to help out. We do things such as a camp we put on for a couple of weeks, something called Teen Driver Challenge for young new drivers. We put them through a course that kind of help them build confidence behind the wheel, especially being at Childs with a lot of young drivers out there. I deal with traffic crashes quite a bit.
When asked about his favorite time of the year, Deputy Strickland says,
believe it or not, it's our busiest time of the year, which is starting shortly football season. I'm an avid sports fan, so I like being around sports this time of the year. I get JV football on Thursdays typically. Friday will be varsity football, and then I'll also work some FSU football games.
If you want to positively impact the youth of Leon County, consider applying for a position at the Leon County Sheriff's Office by visiting our website at leoncountyso.com. For Leon County Today, I'm Captain Jimmy Goodman.
Welcome back to Leon County Today. Sheriff, our school resource deputies, you know, as a mom who has children in schools, I cannot say enough about the importance of their work.
I mean, I have had several meetings with Rocky Hanna and I have getting ready for school year and talking to our resource deputies and talking to the 50 people he's got as security staff there at the schools. And quite honestly, we're ready for school. But the biggest thing is trying to get a message out to our community when school starts back and all the visitations and going back and forth to school and the traffic changes and the students
Yes.
are back from the colleges. And that's the point we've got to be very vigilant about taking care of our kids out there. And the buses are back on the road and they're making those stops. It's a good time of year, but it's also a time we've got to be cautious out there in our community.
Yes, be vigilant indeed. And speaking of taking care of people, you know, hearing the passion coming from Dr. Waters as far as the work that YesCare does, it's one of those things that's it's a tough topic for people to address, deaths and suicide, but mental health is real.
It is real. It's absolutely real. And the fact is, and he pointed this out, that we are the largest mental health provider in this community. And from time to time, unfortunately, something death does happen, unfortunately. And we're trying to do everything we can to prevent those. But with the uptick since COVID in terms of people with mental health issues, is higher than I've seen before, and I think it's backed up by some of the statistics that show that we're having a significant problem here in our country and others with mental health issues.
Yeah, it's a challenge, but it's one we're certainly addressing.
Absolutely.
All right, thank you, Sheriff, and we want to thank you all for joining us for another episode. We'll see you next week.